Fascia is a connective tissue, one of 7, that you have in your body. It mixes and mingles in between lots of different things and different layers, and it has a different job to do. So, in a nutshell, when you're doing this job, this thing that you like to do for the most part of the day, you could be a construction worker or sitting at a desk 8 to 10 hours a day doing this type of stuff. So this myofascial release, what's happening is the connective tissue, the fascia, that is getting stuck to the muscles to help you do this thing you want to do better. So let's do this for a minute. This is my job. I'm sitting at a desk and I'm doing this for 8 hours. So in this position here, I'm leaned forward and I'm flexed. So everything from hips up that's flexed is going to be stuck by connective tissue to hold you in place so that you don't strain the other muscles, that you're overusage in other muscles. So myofascial is where the fascia superficial from here is stuck to the tissues below it, which is the muscle. And that spot that you feel this knot or this tissue, it's either hurting, it's tender, it's painful, it's stuck, it's tight, has no range of motion, whatever you want to use to describe it, they're stuck together and it makes this lumpy feel. So a myofascial release is going to allow these tissues to separate and the knot to be gone, and then whatever was happening before be restored. So if it was a lack of range of motion, now you'll have your range of motion back. If it was a particular muscle not functioning and working correctly, now you'll have that back. If it was just because of pain and too much tightness in this area, we will give you more room so that the parts can move freely and the tugging, the tightness, the pain, the sore, and all this stuff stops. As an example of this myofascial release that we're talking about, I did a massage for a lady yesterday, and we did this specific modality, body balance is what it's called, and she wasn't really sure what was wrong. I know that she's having a connective tissue problem and it's systemic, so her whole body really feels like she's wrapped up, kind of like an ace bandage or a mummy, if you will, and it's all tight. So sometimes people feel that when you're breathing, the breathing you're supposed to be from your diaphragm. If your diaphragm cannot move properly because of connective tissue disorders or things like this, then your ribs and your diaphragm are really stuck together. To have them breathing and expanding, if you're stuck together with this ace bandage type of feeling and everything's constricted, then you're not having the full range of motion in your body, not including just out here, but inside your body as well. So her response to the massage was, wow, I feel like I can move inside my body. I don't feel looser. I feel like there's more space, more movement can happen. She felt like she was breathing better.